Okay, morning everyone. It is 10 o'clock on a Tuesday morning and we are here again for our weekly coronavirus virtual information session. I want to welcome everyone today and specifically our panel who's going to talk to us about the reopening spaces of worship. Before we start with that, let me just give you a few rules here. We have decided to mute all the mics. If you need access to your mic, please message Justin Magnuson, then he will give you the option to speak. If you have a question, make sure to type it in the chat and then we will ask the question on your behalf. And then please use respectful language. And then if you are concerned about your health, please call us at 588-4340 or call the Kentucky COVID hotline at 800-722-5725. Next slide. If you have any issues here, if you have any difficulty with your sound, click on the arrow next to the microphone to test your system. And then lastly, we are asking that you type the name of the county that you are representing in the chat, either where you live or where you work, just so that we know how far we are reaching people. So with that, thanks everyone for being with us today. I am going now first to ask Dr. Laura Morton to give us again our weekly update from a physician about how things are going.
Good morning, everyone. Can you hear me?
Yeah.
Hi, so I'm Dr. Laura Morton, geriatrician here with the Traeger Institute. Happy to provide the COVID update. Yesterday in Kentucky, there were 117 new cases and 2 deaths, and that brings our total in Kentucky to 15,347 total COVID-19 cases and 560 deaths. There have been spikes all around the country, as I'm sure you all have seen on the news. Some places, Arizona, Texas, Florida, and California are truly turning into some hot spots. I wanted to share with you all the guidance that came out on June 25th from the state about phased reduction of restrictions for long-term care facilities. I know I've spoken about that several times, and everybody who has a loved one or knows anyone in facilities is very curious and excited about this. So in this new guidance on June 29th, 2020, which was yesterday, group activities could be resumed with some restrictions. So social distancing must be maintained. So everyone must be 6 feet apart. The facilities cannot have any new cases for 14 days and no more than 10 residents in these group activities. They also recommend that everyone sanitize their hands frequently and wear masks. So the same thing that we're recommending for everyone when they go out in public. Communal dining was also able to be started again yesterday, as long as we can maintain that 6 feet between residents, so maintain the social distancing and no new cases in 14 days. I'm sure the one that everybody wants to know about is the Visitation. And those are a little bit different in their stage. So yesterday, June 29th, 2020, assisted living, personal care, and family care homes were able to begin opening visitation up, but there were a lot of guidelines included in that document from the state. You have to have social distancing and they cannot have any new cases in the facility within the preceding 14 days for assisted living facilities. The visitation date for our long-term care, skilled nursing, nursing home facilities is July 15th. And if you have a facility that has both levels of care, they are recommending to follow the higher level of care, so the July 15th guidelines. And again, even with the nursing facility, each facility is going to come up with their own policy and procedure for that in a location, whether it's outdoor visits, whether it's a designated indoor visit place, but also going to, sorry about that, also going to make sure that you keep the social distancing and that there's no new cases in the facility within the previous 28 days for skilled nursing. So I think that's exciting news. But again, everyone, please keep sanitizing your hands frequently, wear your mask, social distance, and minimize the amount of contacts you have going out because there is a lot of community spread. So thank you very much.
Thank you, Dr. Morton. I really appreciate that update. It's actually really good news that we can help lift that social isolation that so many people have been feeling over the last month. So today, we know that many places of work worship are starting to explore creative ways to reopen in-person experiences. But there's many questions that have arisen about how to keep these communities safe and healthy. So today, we are really excited to welcome a special panel of Kentucky religious leaders to talk to us a little bit about this. The moderator is going to be our own Rabbi Nadia Saritsky. Nadia, I haven't seen you in many years. It's so nice to see you again. She was one of my students way back in the master's program of social work. So welcome. She is the director of program development and engagement of the Interfaith Paths to Peace. And I'm just going to give you a little update of what that is, and then she will introduce the rest of the panel. Interfaith Paths to Peace is a Louisville-based grassroots community peacemaking organization. They have been serving the community for over 20 years with a mission of bringing people of different faiths, cultures, and philosophies together for the purpose of interfaith understanding and social justice based on the principles of peace. They do this mainly through the free pathways of educating, peacemaking, and collaborating, and their vision is to leave a more peaceful world for our children. Thanks, Nadia. I'm leaving it up to you now to introduce the rest of the panel and to lead the discussion.
Thank you so much. So we are very excited because we at Interfaith Paths to Peace have been doing a lot of online programming ever since the pandemic began, with daily worship and meditation online, as well as discussions, and trying to reach out to as many people as possible. And you can learn more about us at pathstopeace.org, or you can see us on YouTube or Facebook. We are very excited to have this great panel. This is actually a part 2. So at the beginning of May, we had a panel discussion about houses of worship and should we open or not, and how should we consider that. And many of the panelists today were on that panel, but we have a few different ones as well. And obviously a lot has changed, even though sadly not enough has changed. So what I have asked all of the panelists to do is to share a little bit about themselves and their respective religious traditions, and how their religious traditions inform their decision to open or not houses of worship. So what in their religious traditions would they draw upon to make this decision? And we have a great group of clergy that are joining us. First is Reverend David Snarden from Joshua Tabernacle Mission Baptist Church. Second is Reverend Dr. Peggy Hines, Transitional Associate Pastor for Anchorage Presbyterian Church, as well as a congregational coach. Then we have Cantor David Lipp, who is at Congregation Adath Yeshurun here in Louisville. Father Bill Hammer, St. Margaret Mary Catholic Church. Reverend Lori Kyle, First Unitarian Church of Louisville. Pastor Celine Azian, Horeb Haitian SDA Church. And Reverend Dr. Carol Harston, Highlands Baptist Church. In addition to that, we've asked Jack Plax, Senior Consultant at Guidepost Solutions, to share a couple of concrete guidance based upon the regulations for houses of worship to consider how to open safely, should that be the decision that they make. So with that, we're going to go in the order that I named everyone. So Reverend David Snarden is going to go first.
Good morning, everyone. And I thank Rabbi Nadia and those that have put this on for this important conversation. David Snarden, I pastor Joshua Tabernacle Missionary Baptist. I'm also running for state representative of the 43rd District. And you all know this is the day they're supposed to be giving us the results. And so I may have to jump off to handle some other things in regards to these results, but I appreciate the opportunity to share. We have not fully opened up yet. I know some other churches have. Some churches probably haven't even closed, but I have an older congregation in the Russell neighborhood in the inner city. And so their safety and concern is paramount to me. But because we are a Baptist church, we are autonomous. We're self-governing. We believe in priesthood of all believers. And one of the things that I have tried to teach is that in order to make disciples of Christ, we need to decentralize the role of the pastor as not just the one that does everything, but each member should be able to share the hope they have within them, to evangelize, to share the gospel of Jesus Christ. And so with this COVID virus, this has allowed us to do some of that, to put in practice as individuals, not really just dependent on the pastor to do everything, to take care of each other, to call one another, to check up on one another, to make sure that people in the church are being fed and cared for, as well as neighbors in the community. We have had discussions about coming back together. We started this month trying on a drive-in service, or drive-up service, where people stay in their cars. We'll bring the PA systems outside, and we would have an outside service. Before then, we were just having a Zoom service. So just like we're on a conference call like this, we would bring our congregation together, and we would just have a service online like this. We didn't do Facebook Live. I like to talk to my congregation specifically, and not necessarily to all the masses. So when we moved to the drive-in service, I was able to do both. I was able to talk to the people through Zoom, as well as have an open community conversation. And that worked really well, but the hindrance is the weather. And so we were able to do that a couple of times, but because of rain or the threat of rain, we had to go back to just having our Zoom service. The interesting thing that I found out, I was trying to move us to a position to get back into the church, but my congregation is not even really showing up for the drive-in service. I think they really like doing the Zoom service much better. And I'm okay with that. So I'm really allowing the church members to kind of dictate how fast we get back to going to the church. We are working on protocols so that when we do open up, we can keep everyone safe, such as we're looking into having someone professionally clean the church of medical, of any contaminants, and that would be something that they do as a profession. So we'll know that that's done correct, and having that done about twice a month. And we'll do the necessary maintenance and cleaning as we go along, but ensuring that everyone has masks, that their temperature is checked when they get here, that there are distancing when they sit and worship. And we are discussing how we will handle the choir. I don't think I want to have a full-blown choir, but maybe we'll have a soloist or just have music played as we come together. One of the reasons why we have refrained from coming together, even after the state said it was okay, is because we didn't feel as if we could come together and worship in a traditional sense in a way that was safe and free, safe and liberating. It seemed very stifling to do everything that the CDC is suggesting that we do. And we are used to being able to worship freely. But then it felt like there was a lot of fear in worship, having contact with one another, or, spitting or breathing on someone else. And so we just decided to keep things as they are for right now. And when it appears, or when we feel better, we'll start moving more aggressively, maybe getting back into the church. But the first step that we would take is if we could just come together in the parking lot and worship in the safety of our cars before we actually open back up and move into the church. So that's the pathway that we've taken, and it seems like a pathway that my local congregation is comfortable with.
Thank you so very much for sharing that. And of course, good luck to you as the day unfolds. We appreciate your sharing some of your time with us, and understand if you need to check out early, but that is very helpful. So I wanted to ask Reverend Peggy to speak next about sort of her religious tradition and faith community's approach to thinking about this question and what religious texts from her tradition guides her decision process.
Thank you, Rabbi Nadia. It's good to be with you all today. I am with Anchorage Presbyterian Church, so we are with the Presbyterian Church USA. And our tradition is somewhat in the middle of Pastor Snarden's Baptist tradition and Father Hammer's Catholic tradition. We are not autonomous in the same sense that Congregationalist churches like the Baptist are, but we also don't have a bishop. So our structure is different. We are ruled by what we call in the Presbyterian Church presbyters, which is where we got our name. Another word that we use for them as elders. So we have elders within our church, a session, which is like a board, who guides the spiritual and physical development of the congregation. We also have regional bodies. The Presbytery is the region which we are in, which Mid-Kentucky Presbytery, which the offices are housed in Louisville, Kentucky. But at the same time, even though we have larger governing bodies who give guidelines and resources and support, each congregation makes their own decisions about how they will reopen and continue to do worship services and other ministries. Our particular congregation is not unlike a lot of congregations, particularly in the Presbyterian Church, in that the majority of our members are older adults. They are in that 65 and older category. So that certainly influences our decision-making on how we will return to in-person worship. We have been very thoughtful and discerning in how we are doing this. We have a reopening task force that's meeting regularly to discuss not as much when we will open, that will be left up to the session, but how we will reopen, how we will do it well. Thus far, since the pandemic began, we have been doing pre-recorded services on YouTube that are available through Facebook. We have a particular set premiere time, which is our usual worship time, where people can come on together. And then after service, we have a Zoom fellowship time so that people have a chance to see one another's faces and hear one another's stories. We've been doing some midday prayers on Facebook, hymns of comfort that our director of music has been doing. And so we've had all these opportunities for people to continue to worship and pray and enjoy music, but from a safe distance. Our plan as of now is to have 2 services outdoors, and we're praying that God will grant us a nice non-rainy day to do that. The first one is actually coming up this coming Sunday, the first Sunday in July, and then we'll do it again the first Sunday in August. These will be our first and only in-person worships during the summer. And then the session will later decide when we will start back in our building, whether it'll be August or September or even later. I just heard recently from another Presbyterian church who have already decided that they will not start back until January of 2021. Others are starting back later in the fall. So we're kind of watching what others are doing. We're also talking to our local schools to see what their plans are and how they are creating safe spaces for the event that school starts back in the fall. And we're kind of taking our cues from them. One of the things that we are implementing in July is since we are getting a little looser on being able to be with people, we're doing what we're calling porch visits with the pastor. So we are inviting our members to invite us, myself or our other pastor, Tara Reck, to come and sit with them on the porch or the patio at a safe distance and have in-person visits. We'll see how that goes. The other thing that we're planning is our building, we had a capital campaign, and we are just finishing up with all the construction from the campaign. In some ways, it's been good for the construction workers because they've been able to continue working with nobody coming in and out of the building since mid-March. So the construction's almost finished, and people are eager to see the new building, what all the changes that have been made. We've added an elevator, we've renovated space. So people are asking us all the time, how's it look? How's it look? So in August, we plan on doing household tours so that people come, just make appointments to come just with their household, and the pastors will give them a tour of the new facilities. So those are some of the things that we're beginning to do that still keep us at a safe distance, but allow us some of that in-person contact, particularly with the pastors. We're also having communion in the outdoor worships. So we've been looking at ways to safely have communion. We did do a communion service with our pre-recorded service back in April, I believe it was, where people were just invited to supply their own bread and juice or wine, whatever they wanted to use for communion. And we did the words of institution, which is what we call the words for communion in our tradition. And then at the appointed time, they took communion. This time, since we are gathering on the lawn outdoors, we will have prepared communion packets that each person will receive when they come, so that they will be able to take communion together safely during those worship services. What has led us in all of our discernment and the work that we have been doing to figure out how to do this well is the fact that we are called to love and care for one another. And that is the scriptural or the theological grounding in how we have been operating. We did not come back too soon. We thought we've been very careful in doing this because we believe that it is our duty as Christians to care for one another and to keep our people safe. So that has sort of been what's driving us. We did a survey of our membership, and overwhelmingly people were not in a hurry to come back. They like the pre-recorded services. They want us to err on the side of caution. And so we're listening to them, and we're listening to God's guidance in how we do this well. So that has kind of been what we have been doing so far. And we know that a lot of other churches and churches within our own tradition have started back already in different ways and different formats. We have drive-through services, outdoor services. We have some churches they have a large enough space and a small enough congregation that they could come back to in-person in the sanctuary services. That is not our situation. Our sanctuary is too small for the size of our congregation that would enable everybody to come and be there together. So that's just a rough, quick preview.
Thank you so very much. Cantor David Lipp, if you can unmute yourself and share a little bit from the Jewish perspective.
Thank you. So Jewishly speaking, there are many situations in which ethically we're asked to balance different goods. One of them is the good of community. For the Jewish people, the minimum count of community is 10. If you're on the far Orthodox side or just the Orthodox side, that means you need to have 10 men to get together to actually have a service. If you're more on the Reform or, in my case, centrist conservative side, you would count adult women in that context as well. So getting together with 10 people is kind of the minimum that you need in order to create the critical mass, as it were, to say certain prayers that you can't say otherwise. And that's considered a very important aspect of Judaism. Most of our prayers are in the first person plural. There are some prayers in the first person singular, but most of the way that we think about the world is creating community amongst ourselves. That's a very important one. The other good that we try to, of course, live up to is the preservation of life, or pikuach nefesh, either the saving of life or the preservation of life and health. And of course, for us at least, that trumps most other considerations most of the time. So again, for my community, which goes all the way from the very traditional Orthodox to the more liberal Reform, and those of us in the middle, whatever we choose to do is going to have to balance those two issues. So for my Orthodox friends for whom there is no use of technology on the Sabbath, they have been, not surprisingly, the first ones to take advantage of the fact that the CDC has allowed for getting together in certain numbers with certain situations. Now, because I'm not Orthodox myself and I haven't been going to those services, I am sure that they are living up to the strictest version of what one needs to do in order to stay as healthy and as unlikely to communicate these things to one another as they might. There's a lot of singing in Judaism, a lot of communal singing in Judaism. And of course, for those who have been reading up on the science of this, it's bad enough to not be able to get together and have to keep our distance 6 feet. But once you start singing, that goes all out the window, and one has to keep, we don't even know how far away you have to be. You probably have to be 20 or 30 feet if you're really singing out the way we enjoy to sing together as a community. So that's been one of the biggest things that we've had to give up. And I have to say that even if we were to decide as centrists to get together in person with all of the things we need to do, we'd have to be so far apart to actually be able to sing all out together. It would almost defeat the purpose. At least that's my personal take on it, which is I think one of the reasons that more Jewish communities have not been getting together more often. So there's a great range of how we are dealing with this. From our centrist point of view for the first couple of months, we did all our services except for those on the Sabbath or on biblical holidays, because I also traditionally do not use technology on the Sabbath, but we felt by the time it got to May, and this thing wasn't ending very soon, that we felt in order for us to maintain community, we would have to find a way to use technology in order to bring ourselves together on Zoom. So we've been doing our Sabbath services on Zoom since then, at least for myself and my own practice, except for those moments where we're actually pulling people together for services. I maintain my traditionality and or my traditionalism, and I don't use my phone or my computer outside of that bubble of time. For me, it's almost like if we were having services in person, would I not open the door for somebody to get in? Of course, I'm going to admit them into the Zoom room, even though I normally wouldn't use a computer on the Sabbath or on Passover or on, for us, Pentecost and so forth. So that's kind of the range of what we're doing. The other thing that we've been doing as a religious institution in order to keep in touch with one another, for our elderly people, there's been a lot more telephone calling than we would normally do because we're not going to be seeing them in person. So there's been a lot of reaching out in that way. There's been a lot more online programming and actually walking those elderly people who are not comfortable with technology, just walking them through installing Zoom on their computer or on their phone so that they can participate in some of these things. And for some of them, it's really been a lifeline of connection. And I think, I'm not the first person to say this, but I think it's a misnomer to call it social distancing. We should call it physical distancing, because that's what we need to be doing. What we're doing right now is not social distancing. We're talking to one another, and that's something we need to find more and better ways to do that are safe, that will keep us in health and in safety. The rabbi that I work with, Rabbi Schlossberg, and again, we're conservative Jews, which is not a political statement. It just means that we're kind of right in the middle between Reform and Orthodoxy. Conservative just means that we conserve a lot of the tradition, but we change more than the Orthodox and less than our Reform friends. when he's making decisions about how and when we will get back together in person, and I'm almost quoting him verbatim, he will say, I don't want cantors making decisions about this. I don't want rabbis making decisions about this. I don't want politicians making decisions about this. I want doctors making decisions about this. So he has pulled together for himself an epidemiologist, a pediatrician, a gerontologist. He's pulled together about 5 or 6 doctors that he trusts. And based on that, for the High Holy Days, which are coming up in September, he's already made the decision because they have said that the risk is simply too high, and the kinds of hoops you would have to jump through to keep it even reasonably unrisky are simply not worth doing. So we are going to be having our most important days of the year in terms of people getting together. We are going to be having them virtually, and we are, believe me, we're spending a lot of time on figuring out how to do that in a meaningful way that people can participate without dying of Zoom fatigue, which I think we're all unfortunately living with at this time. So that's, and then in addition to that, we're doing a lot. We do 13 out of 14 times when Jews would traditionally get together for services. We do 13 of 14 of them every week now online. We do extras. We do a coffee break program every Wednesday. Sometimes it's doctors, sometimes it's academicians, sometimes it's people who want to teach something about Judaism. And then every Sunday night, we feel people need a moment to laugh or to enjoy music that is not necessarily liturgical. So we go back and forth between comedians and musicians every Sunday night at 7. And we feel that's another way to keep our people together when they don't necessarily want or need to pray with one another. So that's a very short version of how the Jewish community in Louisville is handling the COVID crisis.
Thank you so much, Cantor Lip. Father Bill Hammer, if you could unmute yourself and share a little bit from the Catholic perspective.
Okay. In terms of building on some of the things that have been already spoken, the experiences you've had, I pretty much match ours as well. We are a centrally organized religious denomination. I do have a bishop who is giving directions and using and relying very heavily on CDC input and things like that, as well as trying to adapt it. So, but each congregation does have to adapt on. We do have some Catholic churches that still have not yet opened for in-person worship. Our congregation chose to almost immediately, as soon as we were able to, back on that Wednesday of, I think it was May, I think it's May 20th, whatever that Wednesday was when the opportunity became available. We do have a tradition of having weekday services. We do 2 every day. That's before, that was always been our history. And then we have on the weekend 5 services, 1 on Saturday evening, and then 4 on Sunday. And we've placed all those back in place again. Our physical plant, our church holds about 1,000 people. So with the restrictions we place on seating and distancing, the largest service we've had in terms of people attending has been about 200. So if you can imagine 200 and 1,000 person church, there's plenty of distancing. It's quite safe what we're doing. So what's happening is a lot of people are self-selecting not to come back. Interestingly, I think from our point of view, are returning, a higher percentage are those, say, 50 and up. It's the younger families that are actually staying away a little bit more. But they're probably much more comfortable online doing the streaming services. One of our observations has been that the same as even with the Jefferson County school system as encountered, some of our elderly do not have Wi-Fi access. Some of our elderly do not have computers. And even if their family wanted to set up, they still wouldn't be able to manage on their own. Some of our, again, mentioning trying to help them get on Zoom on their phone. Well, some of our families just have flipping phones. And so again, there's a lot of limitations from technology point of view. Now, having said that, that has been a big help for us, the ability to live stream. And those who have that have said how much they appreciate the familiar background, the familiar voices that comes from, as opposed to some generic, online, in our case, Mass. So there's a lot of Mass on the Air programs out there. but to be able to recognize the voice, recognize the faces, recognize the background, is a tremendous sense of comfort for them. Our guiding principle is almost always going to be the common good. And we do have to make individual sacrifices for the good of others. And so to try to figure out ways in which have been very cautious. We do have volunteers set up after every single service to quickly re-sanitize our pew areas and entranceways and things like that. So it has been going very well. I'm aware of some members of our congregation who have had COVID, but none of them have been present in any of our services, and none of them have, after attending, any of the ones who've attended here over the last 6 weeks now, none of them have ever come down with COVID. At least they've haven't been tested. So it's working for us in a very safe way. But we do, require masks. We do require people to sit, socially distanced. We have ways in which we've marked areas that are no seat, areas, no seating areas to try to help facilitate people doing that. As Catholics, we do offer communion, and to do that in a safe way, we've had to make adaptations to our service. Even along the line, as I can't look about the importance of singing. It's also a very important part of our service. We've scaled it way back. And we do have a cantor. We have no choir singing right now. No choir is practicing because, again, the same concerns about the potential spread of disease through that process. So even when we're singing a verse, maybe of a song, just in the beginning, ending, we ask people to keep their mask on. So the cantor alone will take his or her mask off just for the purpose of leading, but then immediately puts their mask back on. So the same thing with myself. I'm wearing a mask all the time, except when I'm leading prayer. So we're making adaptations and changing, but throughout this, we're trying to be adapting as more and more information is available to us. We've never ever seen in our tradition science and faith in conflict. If medical professionals are telling us we need to be careful in this way, then we have to listen, and we have to adapt. I think I already mentioned that one of our guiding principles is the common good. So if we're told for the good of others, we need to make this sacrifice, and that is what we always choose to do as a congregation. Individual members make their own decision and conscience, but it's very clear that everybody coming in church needs to have a mask on. Everyone needs to be attentive to where they sit. And one of the running jokes has been, people do have their own special pew. And now they can see the service from a different perspective. That's always something encouraging to look at, ways that there's a new way, maybe sitting in part of the church where you haven't viewed the service before from that direction. But, we've adapted some over the weeks from our experience, but it has been going well by all experience on our side. We've been able to do it safely. But there's no way that we have any people coming back the same numbers we would ordinarily have. And that's been, for the most part, self-selection. Again, some churches have chosen to have reservations. That's not been necessary for us. We do have a backup room. We have a large meeting area. So one of the things we did do is put chairs in there sufficient distance apart, have a large table that could serve as an altar. If ever on a given service, on a given mass, we find we have maxed out our space and can't do it safely, and we have this overflow area, and there are 2 priests on staff here, and we're prepared to cover for each other. So we have in place a safe backup if it's necessary, but it hasn't been so far.
Thank you so much. We really appreciate your sharing from your perspective, from the Catholic perspective. Reverend Lori Kyle, from the Unitarian perspective, I invite you to unmute yourself and share. I didn't actually see her on, but sometimes people have different names. Reverend Lori Kyle, I'm going to give you another second. Perhaps something came up. If not,
Reverend Lori, are you at First Unitarian Church?
yes.
So you should be unmuted. I'm looking at, yeah, so
Maybe it's just a question of changing the sound, like the volume.
Her mic is not picking up. I can see that it's not responding.
All right. Reverend Lori, maybe keep working on that and let us know when you're on. We're going to go to Pastor Celine Izian from the Horeb Haitian SDA Church. Pastor Izian, are you there? You would also need to unmute yourself, and I also don't see you in the participant list. Okay, we will come back to you too. Reverend Dr. Carol Harston from Highland Baptist Church, if you can unmute yourself, please.
Can you hear me?
Yay! Yes.
Okay. Yes, I think somehow maybe I had been, anyway.
It's okay.
So I am Carol Harston. I'm an associate pastor of faith formation at Highland Baptist Church in the Highlands. And so much of what all of you said is going on here as well. In the sense of we are, as a Baptist congregation, we are local autonomy within the congregation. And that means that we are being good Baptists. We have committees who are working on this. So we found, I think when we last spoke, we really were primarily only doing online, and that is still the case. But we did begin in May to begin wondering how we were going to do this, of what this would look like, of in-person worship. And in some ways, what we're talking about is trying to use language about how we are primarily worshiping online, and we are finding some ways for some people to be in pews with us while we worship online, because we have so many people who really need to stay at home due to age, due to health, that we want to emphasize that online worship is open. And so we're not going to reopen worship because worship has been ongoing. And so we began first as staff in May, and then we formed 2 different groups in late May, early June, who have been working. And one group is looking at attendance. How do we have people register for worship in some way? Unlike Father Hammer, our congregation, our sanctuary holds at max 350. And so to reduce that down is a lot less people. We usually have 3 morning worship services on Sunday morning. And so we've got an attendance group to look at that, to also form a covenant. Some sort of covenant of how our community is going to agree to be with one another during this time, how we care for one another by masks, by social distancing, all the things that you all named, but trying to put it almost in the language of this is part of our covenant together as a congregation. This is our love for one another, is our agreement to participate in this way. So we have one group who's looking at that, and another group who's just literally looking at logistics. So many of our ushers who help people find seats are 60 and above. And what does that mean? And so looking really at how do we logistically get people in and out of our building for worship. So we are not there yet. I anticipate that we might get there at the end of August or in September. One thing that's happened here at Highland Baptist is we have been in an interim season. Many of you know Joe Phelps, who was Highland's pastor for 20 years. And we have been in an interim for over 2 years. And we actually hosted a call weekend for a new pastor online, which is, who blows our mind even while we still think about it. But it was through Zooms for our new pastor, or our candidate, to get to know the congregation. And then the congregation voted through SurveyMonkey, which yet again, who would have thought that we would put SurveyMonkey within our history, but we are. And really what's beautiful is the congregation affirmed our candidate, Mary Alice Birdwhistle, at 98% approval, which is just astonishing for any congregation, nevertheless, in the midst of a pandemic with a virtual call weekend. So she has to also say goodbye to her congregation in Waco, Texas, virtually, which you can imagine what that's like, or through Porches. But anyway, she's coming mid-August. And so we're really going to wait until she's here. We want to make sure we have everything ready for in-person or people in the pews while we worship online, so that she can then help us leading and determining what date that we do that. A few things that I want to note that is specific to us, I guess. One is the fact that recently we found that with all that's going on in our community in terms of racial tension and police brutality and all of these things.
No.
Are
Sorry.
you there? Okay. We put out our crosses on the lawn. It is something that we do every Advent. I don't know if you all are familiar with it, but we did that because of to honor those Black lives who've been killed by the police. And I mention this mainly because it was so helpful for us to have a tradition and practice that is our normal, to be able to have that in the midst of the season where we're not able to be together. And there's so much that we've lost in our faith practices. And then to say to our people, please come by in the next 4 weeks to see the crosses, and giving them that space and their own choice and their own time to be able to come to the church, that's important. We are really waiting to see about the school year and what's going to happen with JCPS here in Louisville, because that will affect our fall, I imagine, and whatever that looks like. And then the only other thing I'll name is that it's been helpful for me to be on some calls with our other Cooperative Baptist Fellowship churches and pastors during the season to hear what everyone else is doing. Even this, listening to everybody else, is so helpful. I'm even going to type an email to our groups to say, I was on this panel, this is what other people are doing, because it's good to learn from one another.
Thank you so much. Definitely, this is a great opportunity for all of us to get new ideas as we are trying to navigate these uncharted waters. I do want to give Reverend Lori and Pastor Izine a chance to identify themselves perhaps through the chat and see if their mics work. So I'm going to wait another minute for them. And in the absence of that, we will go to Jack Plack. So Jack is a consultant, and he is able to tell us some of the logistics that congregations need to be thinking about as they consider whether or not to open their congregations. We already heard a diverse approach to this. Some people saying, well, you have a very large sanctuary so we can safely social distance. Others saying we have smaller ones, looking at reservations. What are the concrete things that need to be happening for congregations to safely reopen? And for those people on the call who are perhaps older adults wondering, regardless of whether the congregations of their respective locations are reopening, what should they be looking for, thinking about, and doing? So Jack is sort of like the logistics person, and he will either he will unmute himself, or Justin will unmute himself. Will unmute Jack Plus.
I believe I'm unmuted.
You are, perfect.
So, well, thank you, Rabbi Nadia, for having me here today, and it's a pleasure. So I very much enjoyed listening to everyone discuss how their particular community of faith and how their houses of worship are planning on reopening. So traditionally, the work that I do with the consulting firm I'm with is security related. So we advise organizations on how to protect their people and their facilities, and that includes houses of worship and communities of faith. But in recent months, as you can imagine, we've been forced to pivot and to look at how we can help with the current novel coronavirus and help prevent the spread of COVID-19. So we've been working with organizations now, and it's not terribly different from what we do from a security perspective, frankly, because it starts with a risk management approach. It really involves looking at the situation, evaluating the risks, and developing measures to mitigate those risks. And so a lot of what we've heard today already has been very much in line with the CDC guidance on reopening houses of worship. And so the types of things that we've heard about are very much, important. I would say that, after a risk assessment is conducted, I think there are two things that I really haven't heard people discuss. And I think the first is that there needs to be training within the organization. People need to understand what the new reality looks like within the congregation, within the house of worship. And that may mean changing different procedures, different ways that you do things from more of a facilities management perspective, really. I'm not necessarily talking about in terms of how you worship, although that should be considered as well. So what does that mean? Well, that may mean changing how people enter your facilities. We know that while this is a predominantly respiratory disease, that you can pick up contaminants from commonly touched surfaces. So, for example, you might want to have your doors open so that people don't have to touch door handles when they come into facilities. And so, you know, of course, unfortunately, these types of things are very much contrary to the things that I recommend to people as a security consultant. I usually tell people to lock their doors and to keep their doors closed. But of course, you know, we have to strike a balance here. So, you know, cleaning and disinfecting surfaces becomes very important. I think that frequent cleaning after every service really is warranted. And the FDA actually has a list on their website of approved cleaning and disinfecting supplies. So that's a resource that you can avail yourself of. You know, I think that one of the best practices that we're seeing a lot, particularly as restaurants and other businesses are starting to reopen, is that they're conducting health screenings. So they may be asking a few questions, they may be conducting temperature checks. I think that that needs to be carefully considered. My personal preference is to ask congregants and to communicate to congregants that if they feel sick, that they should stay home. And again, by providing them with a list of the symptoms that they should be looking for, they can make educated decisions to help protect their fellow community members. Of course, we've heard about hand washing and other hygiene practices. I would think about the kinds of supplies that you need in your houses of worship. So, do you have hand sanitizer? You know, do you have adequate supplies of paper towels and other types of things if people need to wash their hands? So, so that's something that's really important. I'm very much in favor of wearing cloth face coverings to prevent the spread. Again, we have to recognize that this is predominantly a respiratory disease. So coughing, sneezing, again, even the singing and speaking to people in close contact could potentially spread this. So that's something that you have to look at. You know, social distancing within the within the facility, I think, is important as well. Having a reduced capacity. Certainly not everybody wants to come back to worship right now. They would, of course, if the virus wasn't around, but to be safe, they're making individual decisions about whether or not it's safe to come back. And so having reduced capacity may mean that you can accommodate some people, but I would consider whether or not you may need to add services to accommodate more people at a reduced number. So something else I think is important to think about. I come from an approach religion from a Catholic tradition, so I need to think about within the Catholic tradition sharing worship materials and having things like communal holy water. That certainly isn't advised, and so you need to think about those types of things, those commonly shared items that could potentially inadvertently spread this disease. So, I think there are a couple other points that people raise. So, you certainly have your house of worship, but you also have ministries and other types of functions that you perform within your community. And so you need to think about how those can be performed safely, if at all. You need to think about things like nursery and childcare. I mean, that's a real challenge, frankly. And so those are some of the areas that, that I think that people need to consider. Every house of worship and every business, for example, I predominantly work with businesses, but every location is unique and has its own unique challenges. So somebody talked about, again, putting together a working group within within their community. I think that's a great idea. Nobody knows your community as well as you do and what the unique challenges are that you face. So having that type of group and even perhaps bringing in somebody from the local health department to advise, I think would be a great way to move ahead.
Thank you. That's actually a perfect pivot. We only have a few moments left for questions, but there was a wonderful question on the Zoom chat, which is a great way to share questions. And the question is, Kentucky is showing a steady increase in numbers. The curve in Kentucky has not flattened. Are there other numbers that we should consider to feel any confidence in the reopening in Kentucky, including going to church? And I was thinking that this might be a great question for our doctor. There's another question: what is the best COVID practices for restrooms in a small church? Perhaps the doctor can address that as well. So I don't.
Yeah, there she is. Laura, you're on mute.
Let me try. Now, can you hear me?
Yeah.
Yeah, good. No, I think it's important to keep watching the numbers. You know, it's still, there's going to continue to be some fluctuation with the numbers in the state, and it's still, we're still being considered at a plateau. So I think it's important to watch and keep up with KentuckyCovid.gov, which is a very helpful website for looking at the numbers for the organizations themselves. I think the other thing that when you're going to a service or you're looking to go to a service, I think you need to look at the protocols. As we've heard on here, many different protocols have been put in place, and really finding out what your house of worship is looking at doing. So those are important considerations, and how they're socially distancing. If you were to go to a place and they said, we're not going to social distance, then probably you may want to pause and reconsider whether or not you want to go in. But going through and being thoughtful, and I think everybody who's been here and presented today is being very thoughtful in their approach. But if you're frail and have a lot of medical complications, then you have to make sure what's right for you. And if you're very frail, you may want to stay home, just from a medical perspective. And as for restrooms, that's tough because you have to be able to clean in between in a perfect world, but we all know that's not always the case. And sometimes you can even allow cleaners in the bathroom if somebody wanted to clean the area prior to using it. That's another possibility. I know that some churches have tried to keep the restrooms primarily closed, which is also a challenge. So again, I think really just looking at the protocols, trying to figure out what your leadership and your services are going to look like, and then making the decision that works best for you.
Thank you so much. Dr. Fall, do we have time for another question, or have we run out of time?
If there's one more question, we can probably ask that. I don't see anything else in the chat, but
when you get a bunch of clergy together, you're guaranteed to have a couple of sermons there. So I think we did pretty well trying to stay with the time, but I know there are probably lots more questions. And I would say that perhaps if there are additional questions that come up that can't be answered by the Traeger Institute and the doctor, all of our clergy, I'm sure, would be happy to provide extra answers and support. And Dr. Fall and her amazing team can share those with me, and I will filter them to the clergy who participated. We are so grateful to partner with you all in this very difficult time as we try to think creatively about how to show reverence to God and show reverence to one another created in God's image by trying to find safe ways to worship, whether it's continuing with our current status quo or getting creative with alternatives. So thank you so much for inviting us.
Thank you all, and thank you everyone for being on the panel. Thank you, Nadia, for leading it, and we look forward to seeing you all next week again. Thank you so much.
Thank you. Blessings to everyone.